I want to address the swollen legs after baby delivery. Most mothers are worried because when they actually, maybe when they were pregnant, they were not swollen, but after delivery they find that their legs have become more swollen than they expected. I want to assure you that it is normal. Why? Because during pregnancy our body undergoes so many changes, including cardiological changes, physiological changes, and so many other changes. Every system has its own changes, and actually we have increase of around 50% fluid volume that is increased so that it can go through the placenta to the baby to make amniotic fluid and also the development of the baby. Remember, after delivery, now this fluid has to come out because there is no more baby there or placenta. Therefore, the body has to look for another mechanism to shift this fluid or redirect this fluid to other part of the system as the body tries to come back to its normal system. How does it happen? This is now because of osmotic pressure, and so it will go to the lower part of our body, which are the limbs, and also some mothers experience vaginal swelling, which is very uncomfortable. Therefore, you have to make sure that you elevate your legs at this time. Elevate your legs to the heart level so that it helps the draining of the fluid from the lower limb to the system, and then it comes out through the urine. Also, ensure that you take a lot of fluid. During this time is the time you take a lot of fluid so that it can also help to move around the excess fluid that is in the system and come out through the urine. Also, ensure that you are walking around. True walking around is only way of activating your body and other systems to start working normal, to come back to its normal system. Also, at this time, ensure that you are also picking out abnormal things, because every normal thing, of course, might have some other things that might be abnormal. There are also abnormal swelling during this time. What are these abnormal swelling? They include one leg is either more swollen than the other. It's not equal. If it's not equal, like you are having one leg is very, very swollen and the other one is minimal or it's not swollen, it's not a good sign. Also, you are feeling a lot of pain. It might be equally swollen, but there is a lot of pain. You cannot even stand up, you cannot even walk around, and it is either red in color, it's reddened. It's not a good sign. These are some of the abnormal swollen legs. Also, when you are feeling your legs, they should be warm, they should not be cold, because any sign of coldness to the lower limbs or to the legs, extremely cold, it means that there is reduced blood supply or no blood supply to this region. Therefore, it might be an indication of blood clot. I'm not saying that you're having a blood clot, but it might be a reason as to why there is no blood supply, and that's why it is cold. When you find out that you have some of these signs that are abnormal, it is always good for you to ensure that you talk to your doctor and try to find out. Also, when you have these swollen legs and you find out that now you are having high blood pressure at this time, I understand there are mothers who have post-delivery hypertension. There are those also who have hypertension during pregnancy. It is known. Now, if we rule out that you are not hypertensive and it has started just after you have delivered and it is increasing and you have these swollen legs, painful, and all those abnormal things I've mentioned, it is good for you to talk to your doctor to do more investigation and also rule out. Therefore, we have to note that these swellings happen within 48 to 72 hours of baby delivery. So for the first day you might not see the swelling, or the second day now it starts coming, or the third day. Most mothers get so worried. Please, it's normal, it's physiological changes. The body is trying to come back to its normal system. And also during this time you will find yourself passing a lot of urine. You have this frequency of urination. You are going to pee most of the time. For the first 2 to 3 weeks, will be passing a lot of urine will be part of you. You are trying to drain excess fluid that was built during the pregnancy system. Remember, during pregnancy, you even find yourself even having swollen lips swollen, nose, so everywhere is swollen. Now the body has to come back to its normal system, and that's the only way our body responds, by ensuring that you pass that urine through, you pass that urine out. That means empty your bladder more frequently. Don't hold urine.